Welcome to the Pharmacy Leaders Podcast with your host, Tony Guerra. The Pharmacy Leaders Podcast is a member of the Pharmacy Podcast Network, with interviews and advice on building your professional network, brand, and a purposeful second income from students, residents, and innovative professionals.
We're going to do something a little different today. We're going to have Brandon Gerleman, who was on the Pharmacy Future Leaders podcast, and I'm going to update you on how he's doing. He's actually now the Director of Clinical Services at Montross Pharmacy in Winterset, Earlham and St. He was recently appointed to the Madison County Board of Health, and he's now active with the Iowa Pharmacy Association and is on the legislative committee. Well, he's always been active with them as a student. And we've got a really important date coming up, and that is Legislative Day. So January 24th, 2018. That's the legislative day in capital screenings. That's the day that we as pharmacists go downtown to Des Moines and meet with our legislators. I went last year and I highly encourage it. I met with my state senator, who is now Senate President, Jack Whitver, and we talked just briefly about some of the priorities for pharmacists. Those priorities, three of the big ones, are including the expanded role of pharmacists, delegating to technicians, and of course helping with the opioid epidemic, which is something that we are definitely able to do. But what I want you to do is listen to this interview with Brandon Gerleman, see where he was as a P4, and so quickly he's come now to become a clinical pharmacist. And honestly, I know there's that expression that students now are digital natives. Well, I think pharmacy students graduating now, at least from Iowa and Drake, are clinical natives, and clinical pharmacy is just part of who they are. And so I hope I'll one day be able to catch up with them. But I hope you enjoy this episode.
This is Brandon Gerleman, fourth year Doctor of Pharmacy student at the University of Iowa College of Pharmacy, and you're listening to the Pharmacy Podcast.
Today's guest is a fourth year University of Iowa pharmacy student who was president of the NCPA student chapter, which recently won the National NCPA Most Improved Chapter of the Year. He was also vice president of the Graduate and Professional Student Government and comes from Winterset, Iowa. If you don't know Winterset, it's in Madison County, which was made very popular through the novel and film The Bridges of Madison County. Winterset's also the birthplace of John Wayne. Before entering pharmacy school, he earned his bachelor's in health science with a minor in economics from the University of Iowa. Brandon, welcome to the Pharmacy Podcast. Are you ready to tell us about Winterset?
Hey, Tony, thanks for having me. I'm always ready to brag about Winterset.
Awesome. Well, everyone's leadership road is a little bit different. Tell us what you're doing now and how you got there.
You bet. Well, currently I'm on the fourth year of pharmacy school at Iowa. I'm utilizing this clinical portion to put to the use that therapeutic knowledge I gained the past 3 years, and to really gain experiences on these rotation sites that can help me build clinical initiatives in my future pharmacy practice. I'm a little under 7 months out from proudly serving as a local pharmacist at Montross Pharmacy in Winterset, and I'm actually 6 months and 19 days from graduation, but just counting.
That's very exciting.
I've actually been working at Montross for the past 6 years. During my time there, I've developed an immense passion for independent community pharmacy practice. I've been blessed with the opportunity to work with 4 tremendous pharmacists spanning across 3 generations, and I honestly see how they go above and beyond every single day to take care of that patient. Montross Pharmacy, we've actually been serving the population in the community of Winterset since 1921. We also have the fun little niche of having an old-fashioned fountain that provides that kind of nostalgic dining experience.
Tell us a little bit about your current APPE rotation. We have an elective non-clinical APP rotation here at DMAC. You don't really see patients, rather you see students. You get to practice teaching in a couple classes, and the class is your own rather than being a teaching assistant. But what's your current rotation like right now?
It's going well. We only have about 2 weeks left on this rotation. I'm down in Washington County at Washington County Hospitals and Clinics. It's about a half hour south of Iowa City on Highway 1. And really the reason I chose this one, it's that general hospital requirement for fourth year, and it's very similar size to Winterset.
Okay, well, let's talk about the business of pharmacy. The Pharmacy Podcast is about the business of pharmacy, and you are a millennial, and you and the pharmacy you work for have embraced social media as part of that business. I talked with you earlier about what people respond to in a smaller town of 5,000. Can you speak to what events your specific patient population is looking for from your social media content?
Yeah, great question, Tony. For us, social media is really about the community. The most interactions that we have come from promoting community events, specifically those that are kind of involving, health. The other part of that is connecting with local businesses and celebrating store employees. We also utilize RxWiki to post kind of daily or every other day health information for our patients. As far as my role in marketing, it revolves around showcasing all that we offer at Montross, which, by the way, Happy Pharmacy Week.
Oh, yeah. Happy Pharmacy Week and Happy Pharmacy Technicians Day just a couple of days ago. So a very exciting week for pharmacy. Well, tell us a little bit about your local political aspirations. I found that really interesting when you return home.
Yeah. Well, I have the ambitions to become mayor of Winterset sometime in the future. Having parents and a twin sister that are super involved in the community efforts, naturally, I've become inclined to really want to step up and help out. I want to be that individual that helps bridge the gap of where we are and where we want to be as a community. I believe this mayor role will allow me that opportunity to put into action my passion for my hometown.
Well, a couple of days ago, we listened to the third of the debates, and that moderator was really good, asked some very, very tough questions to both candidates. So I will ask your first tough question to you as candidate for mayor. Okay, so as mayor, you decide to tweak the Shop Small campaign, and Shop Small means that you're investing in your local community, to Shop Small, Sell Big. This means that you're not only going to buy in town, but you're also, as area businesses, going to start working together through social media, letting those outside of town know what Winterset offers. So I'm going to read businesses from www.madisoncounty.com/full-day-itinerary. And I just want you to tell me a little bit about each business so we can get to know a little bit more about what they do. So we'll start with the Madison County Chamber of Commerce's Welcome Center.
Yeah, the Chamber and Heather Riley, that executive director, they really do a great job of promoting Winterset as that destination, that weekend destination, shopping destination, and really trying to attract that tourism spot, because we are a tourist attraction southwest of Des Moines here.
What about the Bakery Unlimited?
Oh, man, Marcia Sparks does a great job on those donuts.
Okay, well, donuts are for breakfast and, unfortunately, sometimes for me for lunch. So, yeah. What about Pine Creek Limited?
Pine Creek, well, Bill Moody does a fantastic job with that store, and my mom probably spends a little too much in there.
What about Madison County Mercantile?
Madison County Mercantile, great spot to pick out that last-minute Christmas present.
And I said Angel Wings and Collectible Treasures, and you corrected me with...
Yeah, it's actually Angel Wings and Country Things. We're small town USA over here, but
okay.
Angel Wings is right next door to Montross, and Nicole does a great job of setting up that store.
Okay, and the First Avenue Collective?
First Avenue Collective, that's actually where that old county jail used to be. A really, really neat experience to go in there sometime.
Sounds good. What about Riddell's Smokehouse?
Riddell's Smokehouse, right across the street from the brand new John Wayne Birthplace Museum. Great spot for that beef brisket sandwich and that barbecue fix.
All right. And Winterset Cidery looks like it's a little bit outside of town on Highway 169.
Yeah, well, the Winterset Cidery, it's relatively new. Gary and Debbie Heck do a really good job. And, that fall weather, apple cider, hard apple cider, even better. So great spot.
Okay. The Northside Cafe?
Northside Cafe, Walter Jenke does a really good job of diversifying that menu. And that cafe is really known for its role in the Bridges of Madison County, the film.
Okay. What about the White Lions Bed and Breakfast?
The White Lions Bed and Breakfast, owned by really good family friends, Mark and Kayla Hawkins. They took an old, gorgeous Victorian home and really turned it into that comfortable, homey bed and breakfast feel.
Okay, and the Cobblestone Inn.
Cobblestone Inn just got built relatively recent here. and that adds one more spot to not only make Winterset that healthcare destination, but not only the shopping destination, but also that weekend destination.
Awesome. Well, you're involved in an initiative that helps bring and keep professionals moving towards rural, underserved areas. This sounds like, really, when you're talking about other stores, you're not talking about stores, you're talking about people. So tell me a little bit more about that initiative that you're working on, because I think some of the millennials would like to maybe go to smaller towns. What are you doing to move that initiative forward?
You bet. Well, the initiative is all about staying local and keeping that local talent back home. So it's an initiative from GPSG, that'd be the Graduate and Professional Student Government at Iowa. And we're really trying to gain traction, and we are gaining traction at the state capitol in Des Moines. This is a tax incentive that we're trying to keep these graduates from graduate and professional programs at state institutions to remain in Iowa after graduation. Currently, the GPSG president, who is really taking the bull by the horns on this one and running with it, he has support from both Democrats and Republicans, and we have language being crafted with LSA at the Capitol. This initiative is really important because it keeps all those that have been trained at Iowa institutions, it keeps them in Iowa to practice and remain in the state and really plant those roots. This one's a really easy argument with healthcare professionals, as we have so many provider deserts, as we are, at the end of the day, a mostly rural state. So hopefully, cross my fingers, in the next couple of years, we've got legislation out there that'll really support and really try to incentivize these young professionals to stay in small town USA.
Yeah, provider desert is a very visual graphic, but that sounds like exactly what it is. What do you feel is your area of expertise? What are two things we can really learn from what you do?
Well, in addition to becoming a medication expert, I'm also a fitness and nutrition enthusiast. I'm a real big proponent of the value of lifestyle interventions and the role of preventing disease progression. And I try to take every opportunity I can to include my role as a health and lifestyle coach whenever I'm talking about a medication with a patient.
Well, tell us how you became a leader and how your perception changed when that happened.
Honestly, I cannot emphasize enough the amount of opportunities that the University of Iowa College of Pharmacy has provided me. On top of the new forward-thinking curriculum that has just been implemented that unfortunately I don't have a chance to be a part of, but on top of that, there are pharmacy organizations for every single interest. The students, graduates, and faculty at Iowa maintain a legacy of leadership in healthcare at the state, national, and international levels, providing excellent examples to follow. My faculty mentor, Dr. Jeff Reist, really became a father figure for me at the college and challenged me to get involved. The chips fell into place, and I was fortunate enough to have the ability to help bring an NCPA student chapter to Iowa. This led me down the path of becoming vice president my second year and president during my third year. I can't talk enough about Iowa without talking about Dean Latender. Dean Latender really encourages involvement from day one. He sponsors the IPA, Iowa Pharmacy Association membership for every single student during their entire 4 years of pharmacy school. That's powerful. It really sets a tone for students as IPA does a tremendous job for the profession. Dean Latender really walks the talk. As far as my perception and attitude, they've really gone from that sense of appreciation for what leaders such as Bob Greenwood, Matt Osterhaus, and Randy McDonough, what they've done for the state and for this profession, to a mindset of wanting to roll my sleeves up, jump in, and kind of help further advance that profession right next to them.
Yeah, I'd heard about them. They were actively involved in the University of Iowa Community Pharmacy Residency Program, and I know they were regionally awarded, and now I just recently, I know Randy McDonough certainly, Matt Osterhaus, I've seen them in the national scene, national awards, so fantastic. mentors you have there. And then I did want to talk about Dean Latendra for just a minute, because I met him in 2009, and I've had 2 chances to sit down one-on-one with him. And what really impressed me about him is that when you're talking one-on-one to him, I can only count a handful of people that can do this. He absolutely looks at you in a way to make clear that he is 100% tuned into what you're saying, part sincerity, part genuinely wanting to understand. And I can only believe that the transformation and progress there at Iowa, the new building, the new curriculum, all the things that are going well to make it a national leader have come from that leadership. And it seems like a lot of that listening, the seeing the needs of your local community is part of your social mission that you're on to move yourself, your pharmacy, and your town forward. But let's take a minute and maybe look at one of the biggest challenges you might have had. What's the worst thing that happened to you as a leader, and how did you get yourself through it?
Well, that probably has to be the tendency that I have to say yes to everything. I really want to jump at every opportunity presented in front of me. Especially true in my 3rd year, I was very, very involved to the point where I was probably maybe spreading myself a little too thin, not quite giving that 100% to every organization and committee I belonged to. I was fortunate enough to have great individuals around me that I could delegate tasks out to. I would really say surround yourself with like-minded folks, and only good things can happen. This was definitely the case with the National NCPA Chapter of the Year designation. Without the great exec team that I had around me and the passionate group of members that we had, we would not have had that success that we had this past year. Additionally, I need to give a good shout out. You need to have a great support system. My girlfriend was very supportive this past year and continues to support all these endeavors I have.
Well, I've got 3 kids, 3 5-year-olds, and I couldn't do it without my wife. And I know what it is to have the supportive family. It sounds like everyone around you really is supporting and excited for the things that you're going to be doing. But tell us about a time maybe when you had an epiphany that changed how you thought about something.
Honestly, this one's an easy one for anyone who knows me. It was the minute I learned what a PBM was.
Oh, boy.
As I continued to kind of educate myself as to what a PBM was, what their role is in healthcare, my disgust only grew. From underwater max to DIR fees to PBM clawbacks, these unethical PBM tactics are directly threatening my future and the health of my patients. I haven't even begun to practice pharmacy yet, and I'm already tired of it. I'm already tired of the practices that are restricting pharmacists from providing that optimal care. I currently serve on the IPA Legislative Committee, and I plan to stay involved on these legislative issues surrounding pharmacy for the rest of my career. I'm really hopeful that we're gaining attention on the federal level with H.R. 5951 and H.R. 244. These are both kind of addressing retroactive DR fees and kind of the MAC transparency. So hopefully we're having traction, and we'll continue to have traction there.
You're talking very eloquently about some very difficult problems in pharmacy. So your education, not only clinically, but with what's going on and the challenges that you'll have eventually as a business owner are pretty clear. But let's talk a little bit about the job market. So you personally have this place that you're going to go to, Montross Pharmacy. You've made that commitment, but there's been some negatives, some positives. But you've said that it's a positive outlook that you really have on the current pharmacy job market.
Absolutely. While the pharmacy job market isn't really where it was 10 years ago, there are still many fantastic opportunities out there, as there are so many avenues in this profession. As that baby boomer generation continues to age and the physician shortage gap continues to widen, pharmacists will have the opportunity to step up and be recognized as providers. My advice to everyone is to network. Go out there, talk to other pharmacists, see what they're doing, see what's going good for them, what's going bad for them. That networking with NCPA and IPA has really allowed me to bounce ideas off these other successful independent community pharmacists and to really see what they're doing in those job opportunities. It's all about who you know.
No, I have to agree with you there. What's one thing you're most excited about now?
That's probably jumping off that last question. I am beyond excited for the future of this profession. I'm counting down the days until I join Montross Pharmacy as a pharmacist. Fueled by a couple of performance initiatives in the state, we are confident that we're building a fantastic value-based, value-focused model at Montross. We're using clinical assessments on every patient every time they're at the pharmacy counter. I have that desire to commit these clinical programs to increase that collaboration with local docs and ultimately improve the health of our patients. Eventually, I want to pursue BCPS certification and thinking about that certified diabetic educator certification kind of down the line. At Montross, we're not in the business of merely distributing medications. We are in the business of improving health outcomes. That being said, I still throw out the question of when will our profession get to the point we are paid for our worth and not just supplemented for our reimbursement losses. At the end of the day, community pharmacy is not a cost center. We are absolutely an investment center.
You have just tremendous joy, tremendous happiness, and going towards graduation right now. What blankets of advice would you have for someone that wants to get to that place where you are right now?
Great question, Tony. It has to be finding those great mentors out there that you want to model yourself after. I was privileged with having some excellent examples to follow. The pharmacists at Montross Pharmacy, Jeff Olson and Jason Sultan, they ignite my passion for the profession on a daily basis. I cannot wait to serve beside them in community pharmacy, work next to them every single day. I mean, their passion, if you think I'm passionate, you got to talk to those two guys. Additionally, my dad actually played football at Iowa on the offensive line, had the ability to start in the Rose Bowl and Peach Bowl, and having him as a father figure really helped instill my work ethic at a young age. I grew up knowing the meaning of hard work.
I also had my father was a little bit different in that it was an immigrant, and he really wanted me to have a better life than he did. And it sounds like we were both very lucky to have excellent role models. And that sounds like the best way to go, and something I've heard from other successful NCPA leaders like yourself. So how do you prefer someone contact you? I'm sure with all this excitement, they would definitely want to find out a little bit more about how to have this kind of life, this kind of success.
Absolutely. Well, I invite everyone to contact me and connect with me on LinkedIn, Twitter, Facebook, and email. My Twitter handle is BGERLEMAN.
Sounds good. Well, we'd like to finish with a couple of just quick hit questions. What's your best daily ritual?
That has to be, I'm really highly routine driven, and I try to automate every part of my life and as many parts of my life as I can with habit loops. I wake up at the same time every day at 4:47. I work out at the same time every day at 5:32 in the morning, and I really plan and track everything I eat every day.
What's the best career advice you've ever received?
That has to be from my boss, the owner of Montross Pharmacy. He always says the most dangerous phrase in the English language is, "We've always done it this way." He always challenges us to be sharpening the blade and improving.
What inspires you?
The strong desire to be like my dad. He is the most impactful driving force in my life. He's my best friend. He's the biggest devil's advocate in my life as well. He's always encouraging me and challenging me to improve. Flat out, I would not be the person I am today without him.
Well, Brandon, thanks for being on the Pharmacy Podcast, Pharmacy Future Leaders.
Awesome. Thanks, Tony.
Support for this episode comes from the audiobook Memorizing Pharmacology, a relaxed approach. With over 9,000 sales in the United States, United Kingdom, and Australia, it's the go-to resource to ease the pharmacology challenge. Available on Audible, iTunes, and Amazon.com, in print, ebook, and audiobook. Thank you for listening to the Pharmacy Leaders Podcast with your host, Tony Guerra. Be sure to share the show with the hashtag #PharmacyLeaders.